My role with the patient, first of all, show my empathy, not a sympathy. I don't need to be sorry for my patient. My patient, I want to show my empathy. And what I understand, and it's really how empathy shows for the patient, I try to be in patient's shoes.
Okay.
I need to assist with patient to recognize illness, to control illness, to find appropriate specialists, to find appropriate treatment.
Hi, I'm Haylie Pomroy, your host for this amazing podcast. It's all about hope and help for individuals dealing with fatigue and chronic illness. I am the Assistant Director of Integrative Medicine Program at the Institute for Neuro-Immune Medicine. And today I have an incredible guest that is going to help us shed light on some pearls of wisdom that we can all use to really improve the situation we're in today. So I would like to welcome you, Dr. Irina Rozenfeld, and thank you so much for being our guest today.
Thank you, Haylie. My name is Irina Rozenfeld. I'm assistant professor at the Institute for Neuro-Immune Medicine at Nova Southeastern University. I'm really happy to be here today, and I love the topic about hope and help. I think our institutes have a formula. I do think we have a formula. First of all, I was lucky to be invited to join Dr. Klimas more than 10 years ago.
I'm going to stop you really quick.
Oh, okay.
I'm going to jump in. So you just mentioned one of we call her our fearless leader, right? Dr. Nancy Klimas. And if you can just share with me, Dr. Nancy Klimas is who? We mentioned that. I just want to make sure our whole audience we want to bring you kind of behind the velvet ropes pretty quick, get you guys the help that you need, and make sure that you have access to things that I know a lot of people dealing with complex illness don't have access to. So fill us in. Who's Dr. Nancy Klimas?
So I'm very happy. I think she doesn't need my introduction. I'm really happy to mention, and she's my mentor. She is founding, together with her mentor, Dr. Marianne Fletcher, we have founded this Institute for Neuro-Immune Medicine.
Right.
And she, for many, many years, more than 30 years, paying attention and treating patients with chronic fatigue syndrome.
Wonderful.
And it's also have name myalgic encephalomyelitis. And she also treating patients with many different complex chronic illnesses, which unfortunately sometimes don't have a name yet.
A great diagnosis, yeah.
So, and this is, I think, hope and help as a philosophy of this institute come from Dr. Klimas, that we never say to our patient, don't come back.
Right.
Sometimes, we honest, we don't know what's wrong. It's a lot of peeling the onion procedures, but we trying to share with the patient with hope.
Great.
We're doing research, or we're looking for cures.
I'm going to stop you for a second.
Right.
Because you're not good at bragging about yourself. So I want our community to know who I have the pleasure of talking with today. So you are Dr. Irina Rozenfeld. You were just about to say, before I interrupted you before, that you came to the Institute how long ago?
I joined in 2012.
Oh, wow. Okay.
So
that's amazing.
Just
so over 10 years.
Right.
And can I ask you, so we're going to talk a lot about chronic fatigue. We're going to talk a lot about neuroimmune medicine, inflammatory disorders, individuals dealing with even Gulf War injury. We're going to talk a lot about that on this podcast. You always, for me, instill that no matter what, you hold out hope for a patient to get better. Can I ask you, just on a personal level, you've been here over 10 years, what inspires you every day to still believe that there's hope?
Because I see the results. And it's actually helping us when we see good results and we honestly have good results. So I have kind of formula that would helping us to help patient.
Okay.
And when patient improve or manage their illness and come back and we see good results, this is actually helping us. It's like a ripple effect.
So you said my favorite word. You said you have a formula, because so many individuals that are dealing with chronic illness or chronic fatigue don't have access to adequate care. So by standardizing or making things accessible in a way that's manageable, maybe that they can incorporate with their own practitioner or communicate effectively with their own practitioner. I'm gonna hold you to that formula word and help me kind of dissect out for our listeners, what do you mean by a formula? Like what you look at when your patients come through the door, what type of treatment you like to apply with individuals that are dealing with chronic illness. Because let me just tell you, on the outside, being on the outside over here, it's really hard to get good care when you're dealing with this.
So the formula, me personally, I think there is a formula. I start, and it doesn't matter, patient with chronic fatigue syndrome and myalgic encephalitis absolutely need this approach. But any chronic illness and environmental illness, chemical sensitivity, at least as long. We see different patients with from different walk of life. It's really important to understand who your patient.
Right.
As a clinician, I trained as a doctor of nursing practice, so I'm nurse. My role with the patient, first of all, show my empathy, not a sympathy. I don't need to be sorry for my patient. My patient, I wanna show my empathy, and what I understand, and it's really how empathy shows for the patient. I try to be in patient's shoes.
Okay.
I need to assist with patient to recognize illness, to control illness, to find appropriate specialists, to find appropriate treatment.
Would you go out on a limb and say that if a patient isn't received with empathy from their practitioner, that's a barrier to getting well?
Yeah, empathy helped me to build therapeutic relationship.
Yes.
The therapeutic relationship are really important. I may say.
Oh, I'm sorry. I sincerely just gave me chills because that's not received a lot for patients. A lot of patients don't get that. But I love that you put that first and that you're I believe I watch your work. I get to watch your work, but that you're saying that that's just a must.
It is must.
Yeah.
And it's not my opinion. It's actually big doctors. So it was already in a book.
It's a scientific fact.
It's a fact that
Yes.
it's important. Sometimes
Yes.
it's more important to know who's your patient than what his diagnosis.
Right.
It is really important for me to know a lot about my patient. And this therapeutic relationship, it sounds very official, but it's maybe sometimes it's feel like friendship with your patient, but you are there for the patient.
Right.
Sometimes you cannot do anything, but you're still there, you're present.
They're champion.
And you helping, sometimes it's not your specialty, and I cannot really help, but I can find somebody who are the best in this field.
Right.
And this is my role. In some patients will be only my role. Most of the time not, but it's really important role because we have discovery that chronic fatigue belong to so many diseases.
Right.
And for some patients, my role will be to give them to specialists.
Right.
Who will be the best choice for them.
But I think having an advocate with your obvious expertise in this space, I think having an advocate shortens the distance between a person needing to maybe see a cardiologist and actually getting to see a cardiologist. And what we find a lot in this community is also having you believe them helps and it empowers them to be a better advocate for themselves, for their person too. Wouldn't you say that? I know people that are lucky enough to get to see you, and they're emboldened after the visit. They feel validated, they feel listened to, and they also are much better at articulating or communicating what they're experiencing. So I know there's a lot of teaching that happens in that visit with you about helping people distill down how they communicate with their practitioners. You communicate with their practitioners on their behalf all the time, but they walk out of there doing a better job.
Yeah, you will talk with the patient not just about illness. You have to talk about life. You have to talk about lifestyle. But it's not only all. The formula includes, of course, empathy and personalized medicine.
Okay.
I started working with Dr. Klimas. I took immunology classes, university level immunology classes. We are immunology clinic. And there is, but then I went to all area of anti-aging medicine,
Right.
joined Academy for Anti-Aging Medicine. I went for integrative medicine in a very best medical school in country.
Absolutely. George
and
Washington.
Regenerative medicine. And then I learned that personalized medicine exists.
So
And
can you help me, if you and I could, I think one of the biggest takeaways is defining what is personalized medicine in your heart for you. How do you see that for your patients? I know you also teach at the medical school here. How do you tell nursing school here? How do you communicate to doctors about how to integrate personalized medicine in? I know I'm asking you 5 questions at once. I'm sorry. I just only get you for a little bit of time. So personalized medicine, what is that? When I say I would like personalized medicine, what does that mean?
Though there is a different meaning in some description, it will be genetic medicine and personalized medicine. I would say it's a little bit wider what I'm trying to call personalized medicine.
Yeah.
Each patient is individual, and particularly with
Can you say that one more time?
each patient is individual.
Individual.
Is individual.
Yeah. Again, I got chills.
Their chronic illness, it's not necessary. I'm going to talk right now about chronic fatigue syndrome. So we do have ability right now in our institute. We're doing a lot of research. This is kind of another extra formula that we're doing both things together, and we really communicate, researchers and clinicians. We have like really fast connection and finding what's happening.
Right.
But back to personalized medicine. I see it not we have a body.
Yes.
In the body, it's not collection of the cells, it's not collection of the organs, and it's not collection of the system of the organs. So our patient, we sometimes joke about ourselves who we are. The patient come and it looks like a little bit of neurology, a little bit of immunology, and there is many diseases interact. And patient can have a lot of different comorbidities. Fibromyalgia, chronic fatigue syndrome, autonomic dysfunction, Ehlers-Danlos syndrome. You have an alphabet.
Yes.
Alphabet.
Yes.
We have alphabet of diagnosis. But in reality, when you see on your patient, and I teach pathophysiology, it's
Wait, say that again. You teach
pathophysiology.
Okay.
So
you're throwing out words that just go, I'm going to capture that one.
So you have to look at your patient and help your patient to understand what really happened in the body. The integrative medicine was, for me, really help to see in the body is not a particular, you have this particular diagnosis.
They're not a heart, it's not heart disease. It's
not. It would happen between your brain and your gut and your immune system. What happen between your nervous system and endocrine system and immune system. How your kidney, liver and your gut working together. So this is kind of triads.
Yes.
I study this way. And then you start work with your patient and understand now personalized medicine, where is this patient living, what we eating, what we breathing, what the allergies there, what the many factors affect. And this is where important for me to know, did this patient have a good sleep?
How long are your visits?
Initial visit can last all the way up to 3 hours.
Right.
Follow-up visit from 1 to 2 hours. It depends how much you already know your patient, where you in the process.
But we're not talking about being able to achieve this in a 7-minute visit. No way.
No, this is part of personalized medicine.
Right.
And the second part of personalized medicine that we trained and we empowered with the specialty labs. We can have genetic genetic labs. We can do assessment of epigenetics. So what's the environment doing to you? What's your predisposition from birth? What happened in different levels of your body, and how this system all work together. So this is why visit long. Our immunology assessment, all the tests, environmental testing. It's take time to explain patient why we're doing this testing, and then it's take longer time explain what we find and how we have to treat it.
Right. So what the approach is. Okay. So in the formula, we're talking about empathy. We're talking about personalized medicine, and I want to give you a little bit of a heads up of what's going to come out after the. Yes. But after this, I'm going to have you help me figure out how the average patient in America or globally can ask for this type of care, because we give exquisite and unique care. So we're going to talk about just a couple little, so just, I know you're always thinking about things. I just start to think about that. I want us to do that together before we're done. So let's continue with the formula. So far, empathy. I'm trying to think of how I can have a more empathetic relationship, foster a more empathetic relationship with my personal practitioners, right? I want to make sure that I understand and our community understands some of the verbiage to articulate successfully so that they can ask for, have a desire for, have a right to personalized medicine. And let's keep going with the formula. What's the next step?
I think the next step, it's actually nursing diagnosis. We teach it in nursing school. It's called knowledge deficit. It is official nursing diagnosis.
Knowledge deficit?
Knowledge deficit. Yes.
I would think that would be negative.
It has a code. And I was thinking that knowledge deficit and apparently treatment for knowledge deficit will be removing the deficit. And I have to teach my patient, and then I see how we become empowered. When we understand the disease process, we understand what I'm trying to achieve, why we have to take medications, why we have to change way lifestyle, way sometimes jobs, and sometimes really big drastic changes. But this is a part of treatment for this knowledge deficit, because we got empowered, we understand what happened, we can avoid exacerbations.
So is it kind of closing the gap between them not understanding what's happening to their body? Okay.
Yes.
And so I've had so many clients come in and they're taking medications, and we will ask, why was this prescribed? What is it for? What are they looking for? You know, how long were you supposed to be on this medication? And definitely more often than not, there's not a knowledge about what they're consuming, you know, even pharmaceutically, let alone what shows in their labs. And what I notice that we do really well is we take that time to educate the patient about, you know, and it's because we get to see individuals that come out of the Institute, and they could, some of them could almost teach a class on, you know, well, my red count was this, my white count was that, and that's not that common. And so that's what you mean by that knowledge deficit, closing that gap of the knowledge about their body, what's happening to their body, what their symptoms mean, what their labs mean, what the meds mean, supplements, whatever it is, closing that gap.
The information what's given to patient by us or by another provider can be overwhelmed.
Yes.
Sometimes I did have experience when patient give me a hug and say, thank you for recognizing my anxiety. Sometimes patient needs to understand what makes them sick. Even description, when patient come first time in the office, and some description everything sounds like fatigue. Everything may sound the same, but dizziness may be felt differently by different people.
Right.
So do fatigue. Some expectation can be, there is a patient who fatigue after we work for 8 hours a day and trying to get second job. So it's the bad.
But that goes back to the personalized medicine.
The bad part of their medicine, where our patient with chronic fatigue syndrome, for example, did not found response when we were given answer, everybody fatigue, or I'm tired too. So this is wrong.
Right.
The most important part as a help.
I'm going to stop you 1 second. One of the things that I hear so often with individuals that have chronic illness, definitely individuals that have fibromyalgia, chronic fatigue, is a lot of, and I'll just say it feels patronizing sometimes. A lot of their experiences is that they say they're tired, and they said that I had a client come in and their doctor said, well, yeah, I'm tired too. I work all day, I see patients all day. And it's just so dismissive sometimes. And it's sad and it's frustrating. I'm going to I want to hear the other aspects of the formula. So, because I want us to knit together a walk away for everybody, right? And how they can apply this formula. Even a 10% change in how they receive care can make a tremendous shift in how they realize wellness, right? So talk me through the other aspects of the formula.
So the formula is, sometimes my patients will recognize when I'm saying it, when I tell them that I'm just cheerleader here sometimes. I know I have a long arsenal I have a list of medication to offer. I have a list of questions to ask and intervention to implement. If my patient telling me, as much I will ask a lot of questions, if I know that my patient goes to bed at 1 a.m. in the morning and sleep until 12 because we feel this way. And personally, we not really evaluated well for their sleep. We don't complete sleep cycle. We don't understand what is sleep cycle.
Right.
So I have to unravel it and explain them that you have to be fatigued because of your lifestyle and we need to fix it with medication and intervention. So after with each patient personally, we kind of fixing one problem at a time.
So
it's going to be sleep. It's going to be environment. It's going to be exposure.
So is that, if we're talking about a formula, and we're talking about empathy and personalized medicine, and we're talking about closing the
knowledge deficit.
Knowledge deficit. Yes, I love that. The knowledge deficit. What is this next step? How would we title that?
It's an ongoing process.
Okay, so
you have to do it and do it
and do it and do it. So there is. Can I use layman's terms for a second? There's no magic bullet. There's no magic pill because the body is complex and amazing.
Exactly. And this is how we do see results. And I'm so lucky. I'm so lucky in my patient. Recognize when I say it, when I have to write letters to my patient for accommodation, but at the same time, it was a young patient, come in office in a wheelchair, and now I'm writing letter for accommodation for university abroad, where a student goes to be alone, live alone, and got your master's degree independently somewhere in Europe. It's like such a process which gives us as a clinician goal and pleasure to go back to work and do it over and over and over. And each patient has its own history and trajectory.
Yeah.
And some achieve it faster, and some need longer time and more tender love and care and help to cope.
Yes.
Sometimes when we started with empathy, we may not even hear us. It's overwhelming, and a patient may be absolutely overwhelmed by this illness. So I have to recognize that patient need help with a cope, help with psychological help and medications. And we use a lot of integrative approaches, which are helpful.
And I'm going to have you back. We're going to talk a lot about integrative medicine. We're obviously a passion of mine, right? But how important it is to have a 360 view of the patient, but also a 360 view of the help that we can provide the patients.
I want to notice that from the medical point of view, with chronic illnesses, and very like a lot of prevalence of chronic illness and from different causes, chronic illnesses. But what is important for me, as in our patient with chronic fatigue and myalgic encephalomyelitis, the immune system, and I have to discuss with the patient how body operates and how our immune system is very sensitive. And sometimes we find that there is inborn, like our innate immune system, adaptive immune system. It's affected by how you sleep. It's affected how you eat. The
environment that you're exposed
to. How you sleep. Everything affects how strong your body. And we will study in school homeostasis, but it's allostasis. It's how your body able to back up,
adapt
in a normal good state. And it is process to building this strengths of immune system and strengths of the body to build back and to be able to detox environmental pollution and find the food which is have real nutrition content, and at the same time have medication to control infections and let your immune system reconstitute and kind of be strong again.
And reset itself. So let me ask you a couple things. I'm just going to go through.
Or sometimes actually not to be strong, be more tolerant.
Be more tolerant, right. So that we don't have an autoimmune or a hyperimmune aspect. So everybody's going to listen to this and they're going to obviously want to come see you. And I know that we have a lot.
We like new patients.
Although we have incredible research, we have not cloned you yet. But there's going to be a lot of people. So my brain, there's so many questions I want to ask you. There's 3 things that I want to make sure before I let you go that I get. One is, how can a patient, if you were to say there's 3 things walking into a visit, if there's 3 things that we could empower them with to communicate effectively with their practitioner, what would those 3 things be? Think about that for a second. And then the other thing is, I want to talk about 3 common either cause or underlying things that you see consistently with individuals that are dealing with chronic fatigue or chronic illness. So we'll play with that for a second. But first, in case we heaven forbid run out of time or anything like that, I'm listening to this. I'm wishing I could come see you. It's not a possibility for me right now, but I have a visit with my internal medicine doc or general practitioner coming in 2 weeks. How do I prepare myself to have a better relationship? Can I share with them, this formula? Like a lot of people bring our podcast, to their doctors, send them to their doctors, say, listen to this. What do you think? Our goal here is to deliver globally hope and help, right? We want the help part. Why we chose that name was so that we have actually applicable strategic action steps that people can take. And so what could a person do to be prepared for that visit so that they receive better care?
It's difficult to, so I would not recommend patient who thinks that we have chronic fatigue syndrome to go to specialist and tell. Sometimes patients really do that, call and ask receptionist, would the doctor do this and that and particular therapies? And I would not recommend to do that. If you go to see specialist, let this specialist to be specialist and ask his question. If we choose to go to clinicians, I think we have a reason and some kind of understanding why we go to see this clinician, and trust clinician, and be prepared. Have a list of your medication. Have a list
Make a list.
Make a list. Bring a list of your medication and supplement. Bring a list of your medical records. There is a companies making medical records very convenient, saved on like iCloud, and you can just give doctor code, and everybody can access that one space and read your records. I do a lot of respect for my colleague, physicians and nurse practitioners, physician assistants. There is a lot of majority of us choose this profession because of calling.
Right.
It's not a job.
It's a calling. Yes,
it's
for
a
sure.
calling.
So a lot of times, like I'll tell people, even just basic, when you go in, so I love to have a list. Don't wait for them to ask you. Don't try to remember. Don't try to look at, pictures on your phone of what you're taking. Make sure that you have a list before you walk in. Be organized. Have all of your charts. Sometimes I tell people...
Very good for our patients.
Yes.
I would love our patients send the records before they visit, so that they know that when they arrive, they do have records.
Okay. That's great. So send them before you visit. Confirm with the physician. My other thing that I always tell people is make sure that you communicate with your practitioner that you're a human being, right? So share something, even if it's anecdotal, whether you love dogs or you ride horses or something that sometimes reminds that, and I always say that's one of the best ways to get personalized care, unless you go to somebody that just is indoctrinated in that and does it every day as a profession. But how to get better personalized care at a minute clinic, right, is share something about your person. Make it a personal relationship, or bring your person to the table. Oftentimes we lead when we go to a doctor's appointment with our disease or our diagnosis. And when that's the case, especially if it's reductionistic, if it's like I have a disease, I have a diagnosis of chronic fatigue, or I have a diagnosis of diabetes. When we lead with that, it's conducive to not getting personalized medicine, because you're communicating that that's the focus for the day and that's the focus for the visit.
Exactly.
So
This is what I'm trying to say.
Yeah.
Let them be bold, not bold. Let them be the specialist, they're expert, and listen for that expertise, and then you compare.
Yeah. That's that knowledge gap. So
Right.
Would you say it would be beneficial to communicate to your practitioner that you're aware of a knowledge gap? So that was when you shared that with me a while back ago. That was kind of earth shaking for me, because to call that out, to say, I'm here, I'm having, rashing or whatever's the symptom aspect of it. But I want you to know that I don't really understand what's going on with my autoimmune disorder. I don't really understand my labs. Calling that out and asking for help from your practitioner and having that vulnerability. When you taught me about that knowledge deficit, I went, okay, I can walk into my next visit and really try to shorten that gap.
You have to recognize as a patient that Google or internet, it's a very serious help for us, but it's also create a lot of anxiety, and it's not substitution for clinician mind.
Right.
The computer, all these programs and databases, they can collect a lot of information, and they can provide you, ChatGPT, they can provide you with some information, but still computer doesn't have clinician reasoning.
Well, and also there's the relationship, right? There's the relationship.
And the expertise.
I
would say that more than 10 years ago, when I saw my first patient with chronic fatigue syndrome, I felt very, very intimidated and scared, and it was very, very hard. And expertise with movement from novice to some, I'm still novice, but you have some kind of intuition,
right,
that this patient needs particular approach and another patient needs another approach.
Right.
And you have to calm someone, and you need to actually push somebody to do something.
Right.
So, and this is build up. It's not one visit. You have to make this effort and come back and build relationship with the patient and with the clinician patient. Also, we expect to work together to make therapeutic relationship.
This is amazing. And this is why I wanted to do this podcast with you. I want people to feel that there are scientists and physicians and practitioners out there that, are inspired, right, by the changes that happen in their patients and want to instill.
Good one.
What did you say?
Good one. Inspired.
Inspired by our patients. Yes.
We do come in the clinic. We talk with each other after we see patients.
Yes.
And we share with each other. We have lunch together and we talk to each other. This is what happened with my patient, and this is how, and we all have this melting moment that, it's so nice.
Right. I really feel like this is a gift. I know that you're a gift to all the patients that get to see you.
Thank you.
Absolutely. But this is a gift to the community at large. We wanted to start having this conversation about what true healthcare should look like, how we want to envision that for ourselves, for any patient that's out there, but definitely for the patient that's dealing with chronic fatigue, chronic illness, autoimmune disorders, ALS, like you said, individuals that have environmental toxicity, chemical sensitivity, things yes.
That I forgot to mention that
Yes.
part of the knowledge deficit, and when you bring to the clinic your list of medication and list of medical records. Bring your family, bring your partner, bring that knowledge deficit is actually not as
Bring a friend.
Bring the partner, spouse, family,
That's a
children,
great suggestion.
because if your whole family didn't believe in your illness or didn't support your therapy, it's really hard on a patient. This is one of the parts that this knowledge deficit. My dream to have this clinic facility where a patient can be inpatient,
inpatient,
and family can be there, and we can teach whole family how to really take care of this patient with illness. Then we do have episodes when there is a family. I do have a couple who will first initial visit on Valentine's Day, and we were both kind of crying, and we were saying that this is very recognized on the and they were telling me, I was feeling like very, very, I don't know the word, but they told me, we are really happy. You are the first who recognize that we this illness, and you want to treat us, and you don't send us out. And this is a Valentine's Day's gift. It was very, very strange, but it was really good feeling.
Well, we always say in our institute that we believe you. And if you feel like there's nobody in your corner today or tomorrow or tonight, we are in your corner. And our purpose for doing that is to help you have more tools, more skill sets, shorten that knowledge deficit.
Correct.
Know that we have empathy for you. We're rooting for you. And we're going to continue to give you more and more pearls of wisdom, experiences that we've had, anecdotal patient stories, right?
All right.
So I need you to do one more thing.
And of course, we are always looking for what we can apply. We're doing research, we're studying, we're traveling, we're attending all the conferences possible. We're trying to bring everything possible new.
But I need one thing from you. Mm-hmm. I need you to promise me that you'll come back.
I will.
Okay, great. So
this was my first
You did great. You did great.
Ever in
you
my
did
life.
great. You did great. And this is going to help so many people. And this is why we do this. And I just want to thank you so much for being here.
Thank you for doing it.
Absolutely. This is an institute full of hope. And these are people that are here to serve and to be of help. And we're going to just keep giving more and more tools so that we can get people well. Yeah. So thank you. Absolutely. We'll see you soon.